Hey everybody, we're just waiting for a couple more people to log in and we will get started. Thanks for joining us today. Hopefully everybody got their text message reminder. Oh, thanks, Melody. Thanks for letting me know. Hopefully that reminder helps everybody because I know we all have a ton going on. Put on my background so we could feel like we're at the beach. Actually, I've been to the beach a lot. Let's do some San Francisco. Hi, Lenise. Thanks for joining us. Perfect. So we're right at 4 now. We're going to get started with just a couple of housekeeping things. So there is a chat box. So if you're joining us from your mobile phone, if you have an iPhone or an Android, you should be able to see a little chat button and that'll open up the chat box. So even if you're joining us from your phone, you can still text in to the chat box if you have any questions while we're on this. But if you're joining from the desktop, you should see a little chat bubble and that should open it up. You can either right above where you type the message, there's a little drop down. You can either send your question to everyone or you can send it to me privately so we can make sure that we answer whatever your questions are while we're on here. And it looks like our attendee number is pretty steady, so we will get started. I know our executive director, Chris, wanted to say a few words, so we'll start out with that and then we'll get right into it.
Yes, hi, good afternoon, everyone. The days are getting a little bit warmer and I think we're all making our way through this very challenging time. I participated in a very exciting event last Friday. We did what we call the drive-by parade, and we got to see a few of the people that we support waved hi and exchanged smiles, hellos, and some tears as well. It was nice to see everyone. But with this warmer weather coming around, I just wanted to remind everyone to still be vigilant with hand washing and hand sanitizing, wearing a mask, social distancing. I noticed that some of us are letting our guard down a little bit, including myself. I was telling Alexa earlier that I walked out of my house on Sunday just to run a small errand, and I walked out without a mask. I didn't even have one in my car, and I didn't realize until I was driving that I'm like, oh, geez, I can't even get out of the car like this. So just, be more mindful, continue to be mindful. I think everybody's doing a great job of reducing the spread of this virus, and that's so important. But also, I'm sure during this time, people have experienced some, life events that, such as birthdays, maybe even birth of your children or grandchildren or nieces or nephews. And I'm sure you experience them in a new way, whether it's through a Zoom meeting, or phone calls. And then others have, we've had some sad events where we've lost friends or family members. I just wanted to let you know that I'm thinking of everyone. And, I'm just hoping that we all continue to find the strength to get through these tough times. So with that, I'm going to hand it back over to Alexa, and I'll talk to everyone soon.
Perfect. Thanks, Chris. So just so everyone knows, we are still doing these updates every week right now. We're thinking about in June, maybe moving to bi-weekly, depending on what the circumstances are, but we are doing these every week at 4. We will be sending out a text reminder from here on out about an hour before we get started, just to give everybody a little bit of a reminder. If you have not been on with us before, we're going to just go through some of our reasons and objectives for doing these weekly presentations with you guys. We really just want to make sure that you guys are all updated on any current precautions and communication plans we have as an agency as a whole, any program specific changes or updates, any frequently asked questions that we noticed are coming up a lot, and we just want to make sure everyone has the same information, and then any potential expectations as we move forward. And the last bullet here, the potential expectations as we move forward, that's going to be a lot of what we focus on today, because we do have the results from the remote survey that we just finished on. I think it closed out on Sunday. So we'll be talking a little bit about how we're starting to plan and reimagine PCCS. And so just to reiterate PCCS's priorities, even pre-COVID, but we want to make sure that everyone is clear on them as of now as well. The health and safety for our workforce and the people we support, the continuity of supports and services that we provide, the continuity and stability of employment, and consistent and transparent communication. We really want to make sure that we are driving home those points. And so one of the reminders that we are going to start just kind of repeating every single one of these, just to remind everybody that this webinar is not only for administrative employees, it is for people we support, their family members, our community workers, our direct support professionals, you know, anyone connected to or affiliated with PCCS that might benefit from some of these updates. We do a lot of PCCS-centric information in these, but we also do just some, you know, overall information sharing that we feel can be helpful. So please make sure to share this with whoever you think needs to hear it. So we do just want to go over what PPE is again, and this is something we are going to start to just talk about very briefly every week. And it is recorded, so if for some reason you miss any of these, they are on our YouTube channel as well. But PPE stands for personal protective equipment, and these are items that keep you safe while you're providing services or receiving services. So some examples of PPE are surgical masks, gloves, goggles, surgical gowns, N95 masks, sanitizer and hygiene products, reusable cloth masks, face coverings. Just a reminder, those are not medical grade PPE. So there's not a, you know, scientific filtration system in those, but they are recommended by the city to wear when you can't social distance. Face shields. And a question we've gotten frequently is, do I have to wear all of this PPE every single time I'm providing services or receiving services? And the answer is no. Majority of this PPE is really more so if you're providing services or supports to someone who is COVID positive. So if you were providing supports or services to someone who is COVID positive, you would want to make sure you have something like the N95 mask or the KN95 mask, goggles, face shield, surgical gown. But your typical PPE is really just the face covering or a surgical mask, gloves, sanitizer. You know, those are the more common ones that you'll see being used. And again, if you guys have any questions or if you have any PPE needs, please reach out to either your program contact, that could be your supervisor, or the administrative assistant in your department. And if you feel like you're not sure who to contact, feel free to email us at covidquestions@pccsny.org, and we'll make sure that that gets taken care of for you. Just a reminder, because I know these letters are going out, and I believe they started going out already. PCCS is trying very hard to move to an ACH payment system. And so that's also known as direct deposit. So we know that, especially with everything going on with COVID, the mail has been a little more difficult than usual. So we're hoping that this will help people get their reimbursements faster, their checks faster. So if you're a vendor with us or a self-directed family, please make sure that you're on the lookout for those forms. We will be asking for things like your account number, your routing number. That way we can get that all set up. If you are an employee with PCCS, please go into PACOM and set up your direct deposit. That will also help you get your checks faster. One really nice update that we're happy to say is PCCS had implemented an appreciation pay structure, and it was going to continue until May 30th. We are extending that to June 30th, and it'll be reassessed at that time. A memo will be sent out on PACOM, but this is just a note that this is only pertaining to the PCCS DSPs, not the self-directed employees, because we don't set the rate of pay for the self-directed employees. So if you have any questions about that, feel free to reach out and we'll clarify and, you know, kind of work through those questions. But for our traditional DSPs or PCCS DSPs, the appreciation pay will stay in effect for until June 30th, and then we'll reassess at that point. Any questions before we move on, feel free to type them in the chat box. One reminder that we do want to send out, we did not get a lot of feedback for the poetry contest, so we did still want to do that. We're going to extend the deadline, so please feel free to get those into Alyssa D'Augusto at pccsny.org. So her email is here in the flyer, And of course, we'll send that out in the end of the week email that we send. But we hope that this could just be a fun thing that we do, and there are some gift cards that will be given out as prizes. So just a reminder there. Exercise, we do have the opportunity to get, all of our employees have the opportunity, and this is for traditional employees and self-directed employees, have the opportunity to sign up for free digital workout classes through ClassPass. And so we'll leave that here, and we've been sending that out every week. So hopefully you've seen that, but if you haven't, just reach out to us and we'll walk you through how to sign up for that. And speaking of exercise, we do have a yoga instructor who has volunteered her time to do 2 yoga classes with us. So if you are interested in doing that with us, please reach out to Alyssa D'Augusto, and her email is here. And I'll read it in case you guys aren't seeing this, but her email is adagosto@pccsny.org. And you can sign up for either one or both of those. So they will be on 5/27 at 5:30 p.m. and then 6/4 at 11 a.m. And these will both be live through Zoom. So you'll be able to join a live yoga class. And it really helps, it helps flexibility and relaxing and makes your body feel good. So I hope you guys join us. And just another reminder that we are doing a photography campaign. So if you can please connect with Kevin Roman, and his email is here, kroman@pccsny.org. We are working with the photographer Megan Crapanzano, and we're really looking to capture what a day in the life of giving services, receiving services all looks like. So if you're interested in being a part of that, we want to really showcase and make sure that the work that you guys are all doing and the services and the supports that are so necessary are really visible, especially in the world that we live in today. We have to make sure that we're visible on social media, and the importance of what we do is really out there in a very visual way. So this is just a reminder about the Facebook fundraiser that we have going on. You can also donate on our website. So this fundraiser goes specifically to giving gift cards for food shopping to our DSPs. And this is all the DSPs within the agency, so the traditional and the self-directed. And so if you donate $25 to that fundraiser, you're automatically entered into a raffle for a $1,000 gift card to the tattoo shop in Couture. So we will be announcing the winner June 1st. So just want to remind everybody to kind of get your donations in if you're interested in that. That'll be coming out soon. So one of the last things I want to share before we kind of go into some of the planning stuff is we worked with PACOM to get some trainings up there, and they're very short. You can see some of them are 2-3 minutes, but really stuff related to what's going on right now. So scheduling screen time breaks, quick tips for de-stressing, cybersecurity, how to unwind when you're working remotely. So those are all available on PACOM Learning, and we hope you guys take advantage of those. One of the resources that we wanted to share, and thank you to Nicole Forgione for sending this over. So if you sign up for the, what are they called? Newsletters through the NYC Emergency Management unit of, I believe the website is on the nyc.gov. You'll get all of these alerts and updates, but they do have a couple of calls coming up, and they have a lot of resources and information to share with everybody. So one of the calls we wanted to share is on May 28th at 2 p.m. and it's for community leaders and faith-based organizations, and really talking about the varieties of resources and services that are available. So everybody can head there and get some resources if needed. So now we are going to get to looking at the survey that we just completed. So we sent out a survey link to everybody on SurveyMonkey, and we were really just looking to gauge, how us working more remotely than usual has impacted our services and the supports that we provide, and how we can either continue to do this or, sort of reimagine what this is going to look like. So we split it up into 3 categories. So we had feedback from our administrators who typically work in the office, but are now working remotely. And then we have feedback from our DSPs and our community service staff. And then we also have feedback from the people we support and our families that we support. So the first feedback we're going to look at is the administrators that are working remotely. And there's a couple of percentages here. I just wanted you guys to have them so you have the information, but some of the things that came up is technology needs and access, technology training, and really needing more of a combination schedule because some of their duties they really feel like they need to do in person. So some things that we're going to do are put together some trainings on how to use OneDrive, OneNote, Microsoft Teams, Zoom, those sorts of things. We are going to be looking at between now and June, really assessing every person's role and what their remote schedule versus their in-person schedule could look like and how we can maybe make a combination of that. We will be rolling out a more formal remote working policy that will include an evaluation of how you've been doing while working remotely, and really creating a rotating office schedule to bring people back in to use things like scanners or printers or, you know, some of those tangible technology things that you might need. We will be doing an assessment for who needs maybe cell phones or cell phone stipends or Zoom accounts or, you know, whatever kind of technology needs there might be. And we will do a little bit more research on a couple things that came up, remote drive access and, you know, maybe converting that into OneDrive or, you know, something a little bit easier to use. And then looking into digital signatures for a lot of documents. So that's something that we will do some research on and get back to you guys. But overall, it seemed like a lot of our administrators felt pretty comfortable working remotely. They felt a bit more productive than usual working remotely. So we're hoping that, you know, maybe this is kind of a new way for us. This is some feedback from our direct service employees. So again, there's some stats there that you guys can read and, you know, of course, we'll send out. But for the most part, a lot of our DSPs and community service staff were feeling supported. They were feeling engaged. I did really see that there was still a need of training on what PPE is, how to use PPE, how to make sure that you have enough PPE, those sorts of things. So we will be putting that together. We did already complete the direct follow-up. So if someone wrote into us, and this is for any of our direct service employees or also the people we support and families, if anyone wrote in things that needed direct follow-up, so for example, someone hadn't gotten back to you or so on and so forth, I did reach out to each supervisor, you know, connected to your case and let them know to reach out. So that has happened already. We'll be doing some training again on PPE with everybody, and then looking at a plan to have some people come back to work and do some training and those sorts of things if direct service hours are not available. So we'll be in touch about that. And then we will work with our quality management team in terms of putting up kind of some short videos or maybe YouTube links on how to use some of our systems like Avero and PACOM. And this last section here is feedback from people that we support and their advocates. And again, there's percentages there. And I really just took a snapshot of the information that we were getting. So that way everyone wasn't bombarded with the 257 responses that we had. But we did notice that majority of the responses were from our self-directed programs. So I do really just want to thank you guys for keeping the people we support and the families that we support engaged and informed. We had really good responses from those programs. We had a lot of feedback on having really good communication and that these weekly updates have been really helpful for everyone. So I'm really happy to see that. And a lot of what we heard was, can we get, kind of more clarification and I guess sort of in a scaled down way about even some of the OPWDD processes that have, been manipulated in some way, shape or form due to COVID. So, a very tangible example of that is if someone was new to services and they needed to go through what's called a front door session, they are doing those virtually now. So we will work on over the next week getting, sort of program specifics and then OPWDD specifics, and we'll send that out to everybody. So those are some of the items that we'll be addressing in the action number 3 over there that you see. We'll be moving to ACH payments. We do understand that the mail has been taking longer, so reimbursements have been taking longer. And then there was some direct follow-up of people saying, I haven't been able to reach my program coordinator, or, those sorts of things. So hopefully everyone has already been, connected at this point. But if for some reason you feel like you are not connecting with who you need to connect to, please feel free to email me directly, alexa@pccsny.org. And you can always email COVID questions, and we'll make sure to reroute you to your program contact. So this is the next part that we're going to get into, and hopefully the fun part for all of our administrators, on some things that are going to take place in what we're calling phase 1 of reimagining the PCCS offices. So we'll take a look at this. So phase 1 will take place between June 15th, and of course, this probably goes without saying at this point, but we know that COVID-19 is a very fluid situation. So please note that all of these dates are very anticipated dates. They could very well change if something changes. So we just want to be transparent with that. These are, dates that we think that we can get to. But of course, if something changes, we'll be in touch about that. So we're thinking phase 1 will take place between June 15th and July 15th. And what we're going to look at over the next few slides are very specific office-related procedures. And this will all be sent out through PACOM as well. So, everyone will get this information through the PowerPoint and in a Word document and all that kind of stuff. And I'm sure we'll have it posted all over the building and all that. But there will be a lot of differences coming back, especially in phase 1. We really want to be cautious and make sure that people are safe. We want to make sure that people can be distanced enough. So we're going to go through some of the things that we hope, will help keep everybody safe. So administrative employees must work with their supervisor. As we said before, we're going to work to determine a combination schedule of remote work and in office. So that way we still don't have too many people in the office at one time. All roles will operate on a rotating schedule in order to decrease the density in the main office and create an environment that allows for social distancing. This is sort of a bulk area too when we talk about visitation and meetings. So all visitation at the main office must be scheduled beforehand through an appointment. Of course, we understand that we do provide human services. Things are going to come up, things are going to happen. Really, we have to make sure that we're using really good judgment and decision-making on how we're going to do things. So if you have a last-minute appointment and you notice that there are already 3 people waiting in the lobby, maybe if you can meet the person outside, ask the person to wait to come in until there's more space, if you see that people aren't able to social distance and, those sorts of things. But for the most part, please do your best to try to make sure that things are done through an appointment. Let the front desk know when your appointments are coming so they can monitor that there's no more than 4 visitors at a time in the lobby, so everyone can be distanced, and have a reasonable amount of space to be able to expect that really happens. All visitors still must sign in at the front desk upon arrival. Every attempt possible should be made still in phase 1 to do meetings or trainings, for them to take place virtually, either Zoom or Microsoft Teams, FaceTime, so on and so forth, whatever technology we need to use for that. If there is a program need, though, that a meeting or a training or, a staff intro meeting needs to take place in person, we will stress, of course, that all the precautions that NYC has outlined will, remain in effect, such as wearing a face covering and remaining socially distant, but we do need to make sure that all of our program needs are met. So through phase 1, although we want to make sure we're keeping everybody safe, we want to do things with caution. There are still things that need to get done. There's still, roles and tasks that need to happen in person, and we want to make sure that we're sensitive to that with the people that we're supporting, and we're still, providing the face-to-face supports that we need to. So when we talk about social distancing and proximity restrictions, adhering to being 6 feet apart from each other, meetings should not be held in the office where this can't be maintained. So for an example, if you have an office that, literally maybe is, 4 feet and you can't get that 6 feet apart from one another, move to another space, those kinds of things. Still the same process for booking rooms and that kind of stuff. things like, the kitchen area. We're going to say no more than one person in there at a time through phase one. The room off the kitchen, we're saying no more than 4 people in there during phase one. If the kitchen becomes just sort of way too crowded, and I don't imagine this happening, but the what if, the front desk can take sort of a waiting list and call you when it's your turn to, say, heat up your lunch or those sorts of things. Although we have a lot of multi-stall bathrooms here at the office, we are going to expect that they are single use only at this time. So when you go into the bathroom, we'll ask that you lock the door. So that way we can ensure that it's only, one person using it at a time. And again, through phase one, through this whole month, from June 15th to July 15th, there still will be a rotating schedule. There will not be high density in the building. So a lot of this should be very easy to adhere to with not many people being here. And please, if anyone has any questions, type them in. Hygiene and workspace cleanliness. So, even pre-COVID, everyone was, expected to maintain a certain level of cleanliness and organization in their workspace. But now more than ever, it's going to be really important to wipe down your workstation after every day and before every day coming, starting your shift. All employees will be required and expected to wash their hands after touching any frequently used areas, including but not limited to door handles, sinks, bathrooms, those sort of things. Employees are also encouraged to use sanitizer throughout the day. Employees will need to wear a face mask or a face covering. There are face masks available right when you walk in the front entryway of the building. So if for some reason you don't have one, they will be available as soon as you come in. PPE supplies. So the conference room, which is down the left hallway, is the one that we're referring to. That's mainly being used right now for PPE storage, so it is locked. So if you need access to that room at any point, please just let us know and we'll make sure to maneuver that. But that is where we're storing a lot of our supplies. And, if you suspect that you or another employee is presenting symptoms and is not, social distancing or adhering to any of this, you can feel free to report that. We want to make sure that we're keeping everyone as safe as possible. And that means addressing people that are not taking this seriously. So we did put the corporate compliance information in here. Our corporate compliance officer is Corinne Lopez. You can email her, you can call it in anonymously. You can report it anonymously through the Do the Right Thing email address. So there's, various ways to do that as well. Any questions on all of this stuff? Any concerns? Anyone love it? Anyone hate it? Anyone can't wait to come back? Give it a few minutes. I love the excitement, Nicole Del Preti. Nicole Del Preti is very excited. She said, woohoo. We'll send all this stuff out, of course, via email and all that kind of stuff. But that's pretty much it for today. I want to thank you guys for joining us, and I'll hang around for a few more minutes just in case anyone has any questions. But again, our next one will be next Wednesday at 4 p.m. And I always like to end on a positive note. So for today, what I put in here, and I'll send it out in the email so everyone can listen to it. But Alicia Keys did a song specifically for essential workers and frontline workers, thanking them. And so I thought that it would be really nice to share that with everyone. I know it was a really moving song when I listened to it, so I hope you guys like it. And that's pretty much it. Thank you guys for joining us. And I'll hang around off screen a few more minutes if anyone wants to type into the chat box any concerns they have. We'll talk about it. Thanks.